Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about effects of aging on the digestive system. Frequently, older age, loss of many teeth happening through periodontal diseases may cause difficulty of chewing, which it turns restricts dietary choices. The reduction in the muscle mass of the tongue and unlessened. So, salivation can exacerbate this. The sensitivity of taste buds declines with age. Peristalsis within the alimentary canal reduces, which predisposes to constipation. Other features of aging, such as lessened mobility or poor cognitive functions, also contribute to constipation unless dietary NSP, that is fiber, is increased and an adequate fluid intake is maintained. Liver mass decreases with age, and this is accompanied by a variable decline in its reserve capacity, which can impair metabolism, including breakdown of drugs that may lead to toxicity. In older adults, there is a reduction in skeletal muscle mass, and also responsiveness of hormones, including adrenaline, noradrenaline, and thyroid hormones, contributing to a lower basal metabolism rate (BMR). Limited physical activity or inactivity also reduce BMR. A reduction in BMR that is not accompanied by a lower dietary intake predisposes to obesity and its consequences. Now, let us discuss further detail about what effects of aging on the digestive system. As people age, the digestive slows down to a weaker and muscle contraction and reduced enzyme productions, which can lead to issues like constipation, bloating, and nutrients malabsorptions. Other effects include a decline in appetite, a higher risk of swallowing difficulties and reflux, and a thinning of the stomach's protective lining. The liver may also become less efficient at processing substances, and the pancreas may see a reduction in digestive enzymes secretion. The effects of aging on different parts of the digestive system we'll discuss. Mouth and esophagus. Decreased saliva results in dry mouth and can make chewing and swallowing more difficult. Reduced esophagus mobility causes food to move down the esophagus more slowly, increasing the risk of swallowing problems, that is dysphagia and reflux. Loss of teeth can affect appetite and the ability to chew food properly. Tooth loss with aging is not an inevitable outcome of the psychological, physiological changes, but rather results from the cumulative effects of age related conditions like periodontal disease and tooth decay, often exacerbated by factors such as reduced saliva productions, bone density loss, and a weakened immune response. Stomach and small intestine. Slower stomach emptying takes longer for food to leave the stomach. Reduced gastric acids can lead to deficiencies in vitamin like B12 and iron. Thinner protective lining increases vulnerability to ulcers and inflammations. Lower lactase levels. Many older adults develop lactose intolerance. Changes in gut bacteria. Overgrowth of certain bacteria can cause pain, bloating, and malabsorption. Large intestine and accessory organs. Slowed colonic mobility cause waste to move through the colon more slowly which often leads to constipation. Pancreatic changes. A decrease in size and some tissue fibrosis can reduce the secretion of important digestive enzymes affecting the digestion of fats and proteins. Liver changes. The liver may become smaller with decreased blood flow and less efficient enzymes functions, which can reduce its ability to process certain substances. Some other age-related digestive effects. Yeah, decreased appetite can be caused by changes in hormone production as well as a decline in the sense of smell and taste. Increased risk of certain conditions. Aging increases and the risk of conditions like diverticulosis and colon cancer. Medication effects. The risk of digestive side effects from medications increases as many common drugs can cause constipation or stomach bleeding. So far we discussed about what is the effects of aging on digestive system. We have done. Please subscribe our YouTube channel.